Hello and welcome today. We're diving deep into the digestive system to understand a common, yet often misunderstood, condition diverticulitis. We'll explore what it is, why it happened, how it's managed. So, let's get started. Diverticulitis begins with something called diverticulosis. This is when small pouches or diverticula form in the lining of your colon. These pouches can develop at weak spots in the colon wall, often where blood vessels pass through. While the exact cause isn't fully known, a low-fiber diet is often implicated. This leads to increased pressure in the colon, forcing the lining to bulge outwards. Age also plays a role, as the colon walls naturally weaken over time. Other potential factors being researched include genetics, gut microbiome composition, and chronic constipation. Diverticulitis occurs when one or more of these diverticula become inflamed or infected. This often happens when stool or bacteria gets trapped inside the pouch. This trapped material can irritate and erode the pouch lining, leading to inflammation and potentially infection. The inflammation triggers the body's immune response, causing swelling, pain, and other symptoms. In severe cases, the inflamed diverticulum can rupture, leading to a potentially life-threatening infection of the abdominal cavity, known as peritonitis. Diverticulitis is a relatively common condition, especially in Western countries where low-fiber diets are prevalent. The risk of developing diverticulosis increases with age, with most people being diagnosed after the age of 40. While diverticulosis is common, only a percentage of those with diverticulosis will actually develop diverticulitis. The prevalence increases substantially after age 60. Men and women are generally affected equally. The symptoms of diverticulitis can vary in severity. The most common symptom is abdominal pain, typically in the lower left side. This pain can be constant and persist for several days. Other symptoms include fever, nausea, vomiting, constipation or diarrhea, abdominal tenderness, and sometimes even blood in the stool. It's important to note that some people with diverticulosis may experience mild or no symptoms, making diagnosis challenging until diverticulitis develops. Diagnosing diverticulitis typically involves a physical examination and a review of your medical history. To confirm the diagnosis, doctors usually order imaging tests. A CT scan of the abdomen is the most common and accurate method, as it can clearly visualize the inflamed diverticula and any complications like abscesses or perforations. In some cases, a colonoscopy may be performed after the acute inflammation has subsided to rule out other conditions, such as colon cancer. Blood tests can also help detect signs of infection, such as an elevated white blood cell count. While diverticulitis isn't strictly classified into types, it is often categorized by its severity: uncomplicated or complicated. Uncomplicated diverticulitis involves inflammation of the diverticula without any serious complications like abscesses, fistulas, obstructions, or perforations. Complicated diverticulitis, on the other hand, involves one or more of these complications. The distinction is critical because it guides treatment decisions. Treatment for diverticulitis depends on the severity of the condition. For uncomplicated diverticulitis, treatment often involves oral antibiotics to fight the infection, pain relievers to manage the discomfort, and a liquid diet initially to allow the colon to rest. As symptoms improve, the diet is gradually advanced to include solid foods. For complicated diverticulitis, hospitalization is often required. Treatment may include intravenous antibiotics, drainage of abscesses, and in some cases, surgery to remove the affected portion of the colon. Surgery is typically reserved for severe cases, recurrent episodes, or when complications like perforation or obstruction occur. While you can't completely eliminate the risk of developing diverticulosis, and therefore diverticulitis, there are steps you can take to reduce your risk. The most important is to maintain a high-fiber diet. This includes plenty of fruits, vegetables, and whole grains. Fiber helps to soften stools and reduce pressure in the colon. Drinking plenty of fluids is also crucial for preventing constipation. Regular exercise and avoiding smoking can also contribute to overall gut health and reduce your risk. The prognosis for diverticulitis is generally good, especially when diagnosed and treated promptly. Most people recover fully with antibiotics and dietary changes. However, some people may experience recurrent episodes of diverticulitis. In a minority of cases, complications like peritonitis or abscesses can lead to serious health problems. Recent research is focusing on the role of the gut microbiome in diverticulitis, with studies exploring the potential benefits of probiotics or fecal microbiota transplantation in managing the condition. Also, investigation continues regarding the usage of anti-inflammatory medications to reduce recurrence and severity of flare-ups.